everyone. Today we're going to talk about Chapter 8, the last chapter, so this is going to be our last lecture, Advancing Our Understanding and Interventions for Disruptive Behavior Disorders. So our objectives for today, we're going to review the impact of disruptive behavior disorders. We're going to identify further research needs in the field of disruptive behavior disorders. So even though Chapter 8 has in the title Interventions for Disruptive Behavior Disorders, they actually don't talk at all about interventions. So the two interventions that we're really going to focus on are the ones that are most often used in school, an FBA and a BIP or a PBSP. So I pulled two articles that go into detail on those. So we're going to talk about those as well. So let's first talk about Disruptive Behavior Disorders, Chapter 8. So the prevalence, many sources say that disruptive behavior disorder, specifically conduct disorder and ODD and ADHD, are the most common in the DSM. The consequence of disruptive behavior disorders is well documented. School failure, marital instability, low employment or unemployment, criminality. The cost of disruptive behavior disorders is pretty staggering. It's $3 million excluding productivity. So that $3 million specifically is special education and criminal justice, but it's even more if you throw in the fact that they're not being productive citizens, so they're not producing any type of work or any type of value in society if they are in jail. So the current standings, we know a lot about disruptive behavior disorders. It's a heterogeneous disorder with many different manifestations. There's multiple risk factors, and there's no known specific cause, and there's no effective treatment. So in other words, poor kids with disruptive behavior disorders are kind of screwed. As we said earlier, disruptive behavior disorders, specifically emotional impairment and behavioral disorders, are the least type of research disorder that is eligible for special education services under IDEA. So let's talk about equifinality and multifinality. So disruptive behavior disorders do have these two characteristics. Equifinality is that there's multiple causes that lead to the same manifestation. So we've talked about how there could be genetic causes, there could be brain structure causes, or there could be environmental risk factors, and all of those can result in disruptive behavior disorders. Multifinality is that the same risk factor is implicated in multiple disorders. So any of those things that we've talked about, genetics, environmental risks, brain structure risks, can result in disruptive behavior disorders. So it could be ADHD, it could be ODD, it could be CD, or it could be something else. It could be a totally different diagnosis. So these two issues make it really difficult to talk about the treatment, the etiology of disruptive behavior disorders. The book goes on to talk about how we have to have a developmental ecological framework. And the issue is that there's variations in disruptive behavior disorders. We know that the way that it looks can be very different from student to student. And they worry whether these variations in risk patterns actually constitute the same disorder or different disorders. So for example, does somebody who have CU traits and CD, is it the same disorder as somebody who doesn't have CU traits and has CD? And there's a lot of needs. In talking about a developmental ecological framework, we need studies that identify distinct disorders, their developmental patterns, so how it looks across development, the behavioral presentation and manifestations, so what does it actually look like, reaction to features, and etiology. Research needs to look at how individual characteristics on multiple levels intersect with and transact with contextual influences such as family, peers, and community. So how do all of those things that people who have disruptive behavior disorders come in contact with, like their families, school setting, their neighborhood, how does that affect the way that their disruptive behavior disorder looks and manifests? One of the major needs is more sophisticated identification of disruptive behavior disorders. So in talking about the symptoms, to identify the etiology, we have to have a sound understanding of the symptoms that make up the behavior. So we have to know what atypical development struggles occur, what biological and neuropsychological markers occur, what differentiates it from other conditions, and how the subgroups should be differentiated from each other. There are some issues with diagnostic categories. The diagnostic categories of ODD and CD don't correspond to specific behavior patterns that are seen in in disruptive behavior disorders. So those symptoms that make people eligible for a diagnosis, those criteria, remember for CD you have to have 3 of 15 over 6 months. That's not always exactly what we see in disruptive behavior disorders. Additionally, there's not enough developmental sensitivity. So a lot of those factors in CD, such as is truant, stays out overnight, has robbed somebody with force, they're not developmentally sensitive. Those would never be able to be applied to a preschooler, for example. In the chapter that we read on CU traits, one of the major contributors we talked about was Frick. And Frick says that CU traits form a distinct subgroup of DBD, as well as reactive versus proactive aggression is a very clear subgroup, and life course persistent versus limited adolescence is another very specific subgroup. We also have to look at the seriousness and the level of aggression. So how do seriousness, which is the potential for physical harm, and the level of aggression, the sheer amount or frequency of aggressive acts, how do those relate to the likelihood of CU traits? Because CU traits are going to be an important component that researchers really need to dial down on in looking at the etiology of disruptive behavior disorders. And treatment. So those with CU traits don't respond to parenting interventions. Why is that? And what types of interventions work better for them? It's effective for other groups of individuals with DBD, but not that specific one with CU traits. The book goes on to talk about developing more sophisticated models of development of disruptive behavior disorders. So some of the needs are a more specific and elaborate model of what constitutes a disruptive behavior disorder. And that's going to lead to studies of patterns of occurrence and relations of patterns to risk factors. We need developmental, longitudinal, and laboratory studies to analyze and develop the causal influences of disruptive behavior disorders. It's very difficult to treat anything if you don't know the cause. We need to understand how peer relations, social engagement, neighborhood and community ties help explain the likelihood of disruptive behavior disorders and how those factors influence the manifestation of what the disorder looks like. We have to have an explanation in the role of neurophysiology and neuropsychology. We have to look at structural and functional deficits in regards to trauma, aggression, and other disruptive behavior disorder features. We really have to look at the role of the HPA axis in the endocrine system. We have to look at the extent that the environmental challenges relate to brain changes, so we went into great detail about this when we talked about the paradoxical effect of the basal cortisol levels. And we have to have a map that shows the relation of brain processes and physiology and regulatory processes and behavior neurodevelopmentally. We also have to have a genetic framework. We have to build sampling and measuring models that address questions about shared behavioral patterns and genetic influences on them. The causes of disruptive behavior disorders can be discovered by differentiating passive, additive, interactive, and multigenetic influences and describing the relationship between genetics and developmental expression at different points in development. So that kind of goes back and summarizes what we talked about in chapter 2 when we had the gene environment interplay and the gene environment interaction. And risk models. Most models are summative in that multiple influences cause disruptive behavior disorders. We kind of know that whole chapter that talked about the causes really shows that it's very difficult to distinguish or delineate genetic causes from environmental causes. We also have to look at how family influences are going to be central to understanding subgroups of disruptive behavior disorders. So we did talk about how environmental risk factors are a risk for one subgroup, but not the other. So last, the book talks about needs. We know that the current interventions aren't that great. and it's really difficult to understand why one works and the other doesn't. The understanding of the effects of interventions, it's very general and it needs some work. Specifically, we have to identify what differentiates clinical needs, the appropriate interventions, and subgroups, and the interventions that will work for each. Studies within a developmental ecological framework that include genetics and the measurement of neuropsychological and neurophysiological treatment effects, and studies that look at the reduction of symptoms are going to be important. Studies on family-focused interventions needs to look at which part are focused on altering parental risk, which parts are focused on managing youth and parent risk, and which parts are focused on education. This is going to help test pathways of causation and therapeutic change, and this is going to help develop more effective interventions and treatments for people with disruptive behavior disorders. Parenting interventions are going to be important. As we said, it's not effective for those with CU traits, but we need to have additional research that finds out exactly why this is. And then we have to have better interventions. We have to have more precise and differentiated identification, clear identification of causes and exacerbators of risk. We have to have better characterization of the developmental course. These are all necessary to create better interventions. All of this can also lead to earlier identifications. So that's a brief summary of the important parts of Chapter 8. Chapter 8 was a lot of summary of the previous 7 chapters. We already talked about those in depth, so I didn't include any of those in this lecture. Okay, so let's talk functional behavioral assessment, principles, procedures, and future directions. This article is by Frank Gresham, Stuart Watson, and Christopher Skinner. If you don't know Gresham, become very familiar with him. He is the name when we're talking about emotional impairments. Okay, so Amendment 2 IDA in 1997 said that IEPs now have to use FBAs and PBSP in order to address behavior. The limitation is that the IDEA doesn't state what constitutes an FBA or the essential components of a BIP. But the requirements specifically state that the team must address through a behavioral intervention plan any need for positive behavior strategies and supports. In response to disciplinary action by school personnel, the IEP team must within 10 days meet to develop a functional behavioral assessment plan to collect information. This information should be used for developing or reviewing and revising an existing behavior intervention plan to address such behaviors. In addition, states are required to address the in-service needs of personnel as they relate to developing and implementing positive intervention strategies. So even this is kind of up for some debate. When we're talking about 10 days, it's very unclear. Is that 10 days when it's talking about a zero tolerance offense that results in a manifestation determination review? Is it talking about cumulative 10 days for different behaviors, or is it talking about cumulative 10 days for the same behavior? So it's not very clear, which has left a lot of the process of FBA and BIP up to school districts and their interpretation. So let's talk about the conceptual foundations of an FBA. So why is an FBA what it is? The first is functionalism. It rejects an understanding of behavior based on form or structure because they're merely descriptive and explain nothing about the function of behavior. So functionalism is actually a psychological term, and it really talks about the why of the behavior, not just describing it. Behavioralism is applied behavior analysis based on specific scientific approaches to an examination of behavior. It states that all behavior is a function of the interactions between the environmental events and behavior. And in this instance, when they're talking about environmental events, they're talking about consequences. Experimental analysis of behavior is a little bit different. It's a method of studying behavior and environmental variables, studies behavior in a controlled setting, which is most often a laboratory, and it uses recording equipment to get their data. Applied behavior analysis, or ABA, is studying behavior in a naturalistic setting. It identifies the antecedent, the consequence of the events to design interventions and change maladaptive behaviors. Now remember, when we're talking about a consequence by definition is just what the result is. So a consequence can be either positive or negative. Since IDEA just states that you have to have an FBA, there are multiple definitions of it. One definition is a collection of methods for gathering info about antecedent behaviors and consequences to determine the function. Another definition is the function is used to design interventions to replace maladaptive behaviors with adaptive ones. The goal is to identify environmental conditions that cause and do not cause the behavior. The functions of behavior are often attention, communication, access to tangibles, preferred activities, escape, delay, reduction, or avoidance of aversive tasks or activities, and internal stimulation. A functional assessment is a full range of procedures that can be used to identify antecedents and consequences. A functional analysis is experimental manipulation of an environment to assess function events have on behavior. So most often functional analysis doesn't occur in schools. In treatment options, so you have one of two options. You want to weaken the maintaining response reinforcer relationship of the maladaptive behavior, or you want to strengthen the response reinforcer relationship for the adaptive behavior that replaces the maladaptive behavior. So let's talk about the basic principles underlining FBA. The consequent event. So there's two functions of behavior, and not functions as we were talking about in the previous chapter, but talking overall behavior, positive and negative reinforcement. So positive reinforcement was when you increase access to a stimulus. So social attention, access to tangibles, access to preferred activities, in sensory simulations such as self-injurious behavior or stereotypic behavior are types of positive reinforcement. So remember, reinforcement means that the behavior is more likely to occur, and positive means that you're adding something. Negative reinforcement is when you remove, avoid, delay, or reduce access to a stimulus. So you're increasing the likelihood of the behavior by taking away something that's negative. So for example, if I hit my next door peer who's sitting at the desk, then I am negatively reinforced. I'm getting sent to the principal's office, so they're taking away that aversive activity that I don't want to do. And the antecedent event is just what happens before the behavior occurs. We have to look at discriminative stimuli. It's antecedent event that signals a response is going to be reinforced. So for a child in a classroom, it might be the look on the teacher's face. It might be a tag statement that she says, such as "this is your warning," or it might be some type of nonverbal behavior. Establishing operations are variables that temporarily alter the effectiveness of a reinforcer for behavior. So it either increases the momentary salience of a stimulus as a reinforcer, so it increases the probability that behaviors are associated with a stimulus, or the presence or the absence mediates the effectiveness of stimuli as a reinforcer to increase or decrease the frequency of behaviors. So basically, it's just something that makes the reinforcer work better or work worse. So if a child is really into free time to play basketball as the reinforcer, but they didn't sleep the night before and they're really tired, they're not going to want to expend energy to play basketball. That's going to be a momentary factor that's going to reduce the efficiency of that reinforcer. And a setting event are antecedents events that are removed in time and place from the occurrence of the behavior. So an antecedent is what happens directly before the behavior. A setting event is something that could have happened hours before, the night before, but it's related to the behavior. So for example, a student that has a fight with mom in the morning, it's a setting event for non-compliance at school. It makes them more likely that they're going to be non-compliant in addition to whatever the antecedent is, such as a task that they don't like. Let's talk about the methods and the procedures. So these next couple of slides are going to talk about data collection methods. And remember, when we're talking about data collection, we want triangulation, so we want at least 3 sources. So the first is indirect method. And the first type is a functional assessment interview. In a functional assessment interview, the goals are to identify and operationally define the target behavior, identify the antecedent event, obtain preliminary info concerning the hypothesized function, identify appropriate replacement behaviors. Interviews are often done with parents and teachers. And when we say operationally define the target behavior, it means in objective, measurable, observable terms. So instead of saying the child is non-compliant, that could mean a whole host of things. Instead, we would say the child refuses to complete any task that the teacher presents by throwing their pen and ripping up their paper. So those are things that we can actually see, we can actually observe, and it's objective. It's what actually happens. It's not my opinion. Another indirect method is historical or archival records, and it's a systematic review of school records that includes demographic information, special education status, school transients and attendance, achievement test scores, retentions, disciplinary actions, Title I services, narrative from teachers, a list of accommodations, and a description of interventions that have been used. And the last type of indirect method is behavior rating scales or checklists, and this just helps to identify the target behavior. So this is an example of a rating scale that a teacher might use. There are a whole host of direct or descriptive methods. The first is an ABC chart, which is direct observation of antecedent, behavior, and consequence, and this helps to form the hypothesis of the function. This is an example of an ABC chart right here. Direct observations, which could include observing objective qualities of behavior, including frequency, duration, and intensity. And there's a whole bunch of direct observations that we can do. The first is event-based recordings, which measures the frequency of discrete behaviors. And discrete behavior means that it has a very clear start and a very clear end. These are easily converted to a rate by dividing the number of times it occurred by the number of minutes or seconds or intervals that it's being observed for. A planned activity checklist doesn't measure the frequency of the target behavior, but it can show the typical behaviors of other students. So it's very similar to like a tally chart, except you're not looking at the target behavior. You would be looking kind of at the opposite of the target behavior. So if your target behavior is off-task behavior, then you're going to look at certain times and you're going to see how many of the other students are actually on task. A scatter plot is used to help determine the time of day and whether or not that's related to a behavior. So you would plot the number of frequency of the behavior with the time on one of the axes, and that will give you information. Does it happen more in the morning? Does it happen more in the afternoon? Or it can be, instead of time, it could be event specific. So does it happen during math class? Does it happen during reading class? And the next is interval based. And what you're doing is you're looking at whether or not the behavior occurs or doesn't occur during a specific interval of time. And this is best for behaviors that are continuous. So you might be looking at whether or not the student is off task. You might be looking at whether or not the student is disrupting the class by yelling. And there's 3 types of interval based. The first is partial. So this happened at any time during the interval. So your interval could be 5 minutes, it could be 15 minutes, it could be 15 seconds or 30 seconds. Whole interval, it happened during the entire interval. Or point time sampling, it happened at the end of the interval. And when we talk about time-based, we're talking about the measure of duration, latency, and inner response time. So duration is how long the behavior lasts. It's often reported as a % of observation time. So if I observed for 5 minutes and the behavior occurred for 4 minutes, then I would say that it occurred 1/5 of the time, or about 80% of the time. Latency shows the amount of time that elapses between an environmental event and the behavior. So if we're talking about noncompliance and it's task specific, so how long is it before the teacher presents the student with the task and the student rips up the paper? And inner response time is the amount of time that elapses between instances of the same behavior. So how long was it between the time that the student ripped up the first piece of paper and they ripped up the second piece of paper? And a permanent product is another type of descriptive method. It's a measurement of the actual physical byproducts of behavior. So it could be, if you're looking at on-task behavior, the number of worksheets that it's completed. If you're looking at non-compliance, it might be the number of worksheets that they actually ripped up. So once we've collected all of this, we then have to summarize the functional behavioral assessment data. So the first thing that we do is we formulate the behavioral hypothesis. And we have a statement about the presumed function of the behavior. It must be based on the information from the assessment. It must specify variables that can be tested, measured, and manipulated, and everybody on the team has to agree on the hypothesis. We then construct a competing behavior pathways model. And this is a graphic description of the variables. It links the behavior intervention to the FBA data. It matches value skills, and it matches the capacity of people who are going to implement the plan. This helps to enhance treatment integrity. It increases the logical consistency of the intervention plan. It has to include the conditions or the situations that lead to the behavior, the specific desired behaviors, the problem behavior, the alternative behaviors, the analysis of consequence. So there's a difference between the specification of desired behavior and alternate behavior. So if we're talking about somebody who is physically destructive, then the specified desired behavior is that they're actually going to be sitting there doing the work. And the replacement behavior is, instead of ripping up the work, they ask for a break. So those are different. We also then have to have an analysis of the consequence. It's important to remember that the problem behavior occurs because it's more reliable and it's more efficient than the alternate behavior, or that positive adaptive behavior, in achieving the function of the behavior. We then have to do some intervention planning. It has to be based on the pathways model, and that's an example on your screen of the pathway model, and it has to be focused on changing the antecedent event. So that's always going to be the first step. So we can alternate a student schedule, we can change the size of groups, we can shorten a task length, we can alternate difficult tasks with easy tasks, we can adapt curriculum, and we can provide a break. We change the consequence events by increasing the value of a consequence for desired behavior and decreasing the value of the consequence for the problem behavior. So this deals with the matching law. And the matching law states that we have to have a relative rate of response for two or more behaviors that will match the relative rate of reinforcement. So what this means is, if you want this student to perform this alternate behavior, then you have to match when it's reinforced with how many times it is performed. So if you want them, especially when you're first teaching, if you want them to do this replacement behavior all the time, then you're going to have to start with reinforcing it all the time. But if they perform this behavior 10 times before they receive reinforcement for it, they're not likely to actually perform that behavior again. And then the last step of intervention planning is directly teaching that replacement behavior. So this article also mentions experimental functional analysis and brief functional analysis. So these are probably not going to be done actually in the classroom. But an experimental functional analysis is exposing an individual to each of the possible maintaining conditions in an experimental design. So all of those functions of behavior. It includes social attention, access to tangibles, escape from aversive stimuli, automatic reinforcement, and a control condition. We look at the rates of the target behavior under each of these conditions. They're then graphed and they're compared, and the one with the highest rate is considered to be the function. So if we look at all the way on the left of your screen, at that very first one that says analog assessment on the right-hand side, as you can see, ignoring the behavior had the highest response. And a brief functional analysis is where you have one condition per session instead of doing all of the functions at once. The first session focuses on attention and escape, and we look at replication for the best and the worst conditions. And the highest rate is still considered the function. Obviously, this is time consuming and it has to be highly controlled, which means that it probably isn't actually going to happen in a school setting. Often because there's no set requirements for an FBA and the FBA process isn't very delineated in IDEA, it does result in some issues. So behavior modification is intervention without considering the function. If we just do behavior modification instead of behavior analysis, it could result in 4 issues. The intervention may strengthen the problem behavior through positive reinforcement. So that's not something that you want. It may strengthen the problem behavior through negative reinforcement. The intervention may be functionally irrelevant to the behavior, so it may not even deal with the function of the behavior at all, or it may not provide alternative behaviors. Behavior modification versus behavior analysis. Behavior modification is effective in 3 situations: where the assessment cost exceeds the treatment cost, where the consequences of delaying treatment are minimal, and no link is found between behavior and function. So those are 3 instances where behavior modification is acceptable, and any other instance you would want to use behavior analysis. In the consensus, behavior analysts have problems in agreeing on the function of behavior. So if we had some highly trained ABA specialists and we had them sit down with the triangulation of the data, they very well may determine that there is a different function of the behavior. And reliability and validity are an issue. So do the same behaviors are they seen by the same people? So one person could look at it and say that it's noncompliance, but somebody else could look at it and say that it's physical destruction or aggression. And the other is that the FBA isn't really generalizable to other situations or settings, and that's a problem with the validity. Okay, on to our last article, Positive Behavior Support Assessment Guide, Creating Student-Centered Behavior Plans. So this is an actual experimental study, and I left out the experimental stuff because it's not really relevant to what we're talking about, but I thought that this article, as opposed to some others, gave some good information on what should actually be included in a positive behavior support plan. So positive behavior support, as we know, was actually reauthorized under the 1997 IDEA, and it includes PBS as recommended form of intervention for students with behavior issues. IEP teams are required to use positive behavior support strategies for children whose behavior impedes their learning or the learning of others. And PBS, like FBA, because it's not really defined in IDEA, does have a couple of definitions. It's a broad range of systematic and individualized strategies for achieving important social and learning outcomes while preventing problem behavior. It's a data-based, proactive decision-making and problem-solving strategy. It's a comprehensive support ecology consisting of multiple interventions derived from diverse theoretical and philosophical perspectives, including social, behavior, and biomedical sciences. So the goals for positive behavior support is to acquire new skills, decrease problem behavior, improve the quality of life for students, family, and the support team, and also address the cause of behavior that respects the student and their individuality. The process is you collect data, you formulate the hypothesis about the function of the behavior, and then you individualize instruction to teach a new behavior. You establish a system of consequences and a method of monitoring and a method of evaluation. So let's look at some of the important parts that this article talked about. The first is behavior. Operationally define the behavior using specific language that allows anyone to recognize the occurrence. So in special education, we have what's called the 7-11 test. And we talk about this when we talk about compliant IEPs. So if I were to take my IEP to 7-11 and give it to somebody there, a worker, somebody who's there, In other words, anybody that knows nothing about education, would they be able to have a good, sound understanding of what that student looks like based on the IEP? And this is the same thing for the positive behavior support. Is that behavior defined so precisely that anybody who walks in who's not trained in education can identify it? It has to be objective, observable, and measurable. And the hypothesized function of behavior is stated. It offers a complete picture of the student, including the student's views on why their behavior occurs. It has to have a replacement behavior. And remember that the replacement behavior has to achieve the same function as the problem behavior. So if we're identifying the problem behavior as access to tangibles, then that replacement behavior has to result in that access to tangibles. The plan is written down, and it has to have a clear reinforcement schedule. It has instructional and supportive strategies. So it has antecedent procedures, social skills training, consequence procedures, curricular adaptations, and crisis management procedures. So antecedent procedures, what are we going to do to prevent that behavior from occurring? Social skills training, how can we help the student identify and gain those social skills to reduce the behavior? Consequence procedures, what's going to happen if the target behavior occurs or the replacement behavior occurs? Curricular adaptation, so how can we change the curriculum to reduce the behavior? And crisis management procedures. If the student gets so out of control that they're a danger to themselves or a danger to others, what's the plan for the child to be de-escalated safely? Positive reinforcement. So that's the whole point of a positive behavior support plan, is to use positive reinforcement strategies that have a very specific schedule. So if the child does the replacement behavior, it should be written down what exactly is going to happen as a reinforcement. How many times does the student have to perform that replacement behavior before they get reinforced? Ecological system. It has to provide environmental changes. So as I said earlier, that's the first step. Physical environment, instructional delivery, or adult interactions. So adult interactions are going to be the hardest one that you guys are going to deal with in school. It's really easy to do the environmental changes, the instructional delivery. Teachers are more willing to do that. The way that teachers interact with students, that's what you're going to struggle with. Especially for those students, as we know, who have disruptive behavior disorders, one of the things that they really don't respond to is sarcasm. And as we know, a lot of times when teachers are frustrated with behavior, they respond with sarcasm, and it doesn't work. And if they respond with sarcasm, that starts a negative relationship. And as we know, students with emotional impairments, relationships are everything. Individuality. The interventions have to be based on individual needs, as demonstrated by that triangulated data, so that 3 or more sources of data. And it has to describe the data collection methods for intervention. So how did you find that data, and why is that data proving that these strategies are going to be effective for the student? And long-term, has to take into account long-term goals. So yes, our short-term goal is always going to be to reduce the behavior. But what is that reduction in behavior? What is it that we want that to do? Do we want them to produce more work? Do we want them to pass the class? So we want to look at those long-term goals. And it has to be comprehensive. It has to address opportunities for the student to interact positively, to demonstrate responsibility, and to have some accomplishments. So we don't just want to get rid of the problem behavior, but we want to develop the student into what we consider an ideal student, performing all of the actions and all of the functions that a teacher expects a student to do. So this is our last lecture. It was nice having you guys. I hope you enjoyed them.